Gary, walk me through your findings. How did you do it? What were your big takeaways?
We collaborated with an international consulting firm called Arup, and we looked at emissions across 43 countries as well as all around the world. And we found that healthcare, which is the one sector of our economy that is healing as its mission, is itself a large polluter, contributing to the very diseases that it's trying to solve for.
How does it pollute the most? Where does the most pollutant come from?
Its reliance on fossil fuels is by far the largest contributor to greenhouse gas emissions and the climate crisis. So its responsibility is to wean itself from its reliance on fossil fuels and toxic chemicals to move toward renewable energy to run its facilities, its supply chain, its products, the food it buys. Fossil fuels really is the heart of this problem.
Well, I was going to say, is this like buying an EV ambulance or putting solar panels on a hospital? Like what's the low-hanging fruit? What's the higher-hanging fruit?
The low-hanging fruit is the energy efficiency that hospitals can use. They can take waste heat and run turbines, so even in extreme weather events, they can operate, because we need healthcare institutions to be the safe harbors in the storms and rising seas of climate change. So energy efficiency is a key thing. They can change their use of anesthetic gases. Certain gases are 2,000 times more potent than carbon dioxide. They can invest in renewable energy to run their facilities, because it actually saves them money and locks in price guarantees as well as energy guarantees. So energy, transportation, anesthetic gases, changing the way they buy food to buy less meat and better meat and support sustainable agriculture. Healthcare is such a large part of our economy.
So
20% of our economy and 10% globally. It can leverage its purchasing power to drive toward a renewable energy and green chemistry economy.
So Gary, how much would that cost? Like, say I was a CEO of a hospital and I was going to retrofit it. Like, can you put a number on it?
It actually turns out to be a savings. So there may be an upfront investment, but within a few years, you're starting to save money year after year after year. So many of the interventions that we recommend to move healthcare to a renewable energy future actually will save healthcare lots of money directly, but also when it comes to addressing the health impacts of climate change. We know that air pollution kills millions of people every year around the world, more than AIDS, malaria, and TB combined. If we can move healthcare emissions to near zero net emissions, we will actually reduce many diseases that are driving up healthcare costs. So it has
Gary,
a huge positive benefit for the rest of society.
So Gary, I can see about over time it's going to be profitable and actually help these hospitals, but can you give me some numbers behind that? Like, what's the payoff? Like, you have to invest $50 billion up front, but in 5 years you make your money back. I mean, what are some of the calculations?
The calculations are, there's some investments, for example, take a hospital in Wisconsin, Gunderson Health System. They invested $2 million in energy efficiency strategies and renewable energy, and within 2 years they had already got their payback, and they were making $1 million a year in savings. That's one small hospital in Wisconsin. We roll up the entire healthcare sector, there's a savings of billions of dollars over time. And also, there are now many mechanisms that allow hospitals to not make any investment up front in the renewable energy. They just have to be a guaranteed buyer for that renewable energy asset, which could be located in many different places in America. So they have a guaranteed purchase of that, and that provides the owners of the asset with a guaranteed return. So there's a way, it's called a power purchase agreement, which hospitals don't have to invest in at all to move forward in this strategy.